Yeah, please start.
Good morning, everyone. So my topic is dry eye in diabetic patients of rural Punjab. It was an ICMR project. So diabetes, only 34% cases are recognized and just 14% are well controlled. And dry eye syndrome is the most common and underdiagnosed complication. So our aim is to diagnose the dry eye in diabetes patients of the rural Punjab, and objectives were to screen the population of undiagnosed cases of dry eye in diabetic and non-diabetics, and explore the correlation between diabetes mellitus and dry eyes. So it was a cross-section study. Community-based health camps were conducted, and there were two groups. Group 1 was diabetic and group 2 was non-diabetic, and sample size was 262. So firstly, community notification was given, and outreach camps were conducted in 7 different villages, and consent was taken. Participant registration based on the inclusion criteria was there, and RBS and dry eye testing and symptom assessment was done via Shermer's test and OST screening, and HbA1c sampling was done, and stats analysis was done afterwards. And results was age was significantly associated with dry eye syndrome risk, and gender and diabetes duration was not associated with it. With the increasing age, there was increase in the risk of the dry eye syndrome, and whereas gender and duration had no significant value in it, and diabetes had more severe dry eye syndrome. In Shermer's, there was severe dry eye syndrome of 42% of the diabetes, whereas 10% of the non-diabetics were there. Whereas in OSDI, there were severe dry eye syndrome of 80% diabetics, and non-diabetics there were only 45%. So in diabetics, there were reduced tear production, increased severity of the symptoms, and there were increased RBS. So average Shermer value in diabetic was 6.3, whereas in non-diabetic was 11.1, and average OST score was 62.3 in diabetics and 40 in non-diabetics, and RBS was in diabetic it was 209, and in non-diabetic average was 115.4. So correlation of RBS with Shermer's and OSDI. Higher the blood sugar level was linked to the reduced production and worse eye dry eye symptoms among the diabetics. So correlation between HbA1c and Shermer and OSDI was taken. It was not significant. So a routine examination and checkups rarely screen. Routine diabetic checkups rarely screen for dry eye syndrome and missing a major comorbidity. So simple low-cost tools, that is Shermer and OST, can be easily added to the rural camps. So it was our conclusion. Routine screening with the Shermer and OST can detect the hidden burden and early improvement of the comfort and prevention of the vision loss. Integrating dry eye assessment into diabetes management is a practical and urgent need of rural health programs. Thank you.
So, is there any seasonal variation in this? Have we studied that?
Sir, we have not studied any seasonal variation. We have not studied any seasonal variation in it.
But you may have the data for that. What season you conducted the camps and all?
It was summer season.
So you can find out any confounding factors accordingly. Also, did you do HbA1c for your study? Because in discussion, HbA1c for your study, did you do it?
Yes, ma'am.
How did you do it? Because it takes. Did you bring the samples?
Yeah, ma'am. We took sample from there, and from our college, then we did that.
Who bore the cost of those tests?
It was an ICMR project, so it was a fund from the government.
Was this part of your thesis? Was it your thesis?
No, ma'am.
Okay. Was it community based? You went to the community?
Yes, ma'am.
And did you, was there, like for example, which Shermer's did you do was one of my questions. Which type 1? So it had reflex. Can you just give me the mechanism of dry eye and diabetics?
Yes, ma'am. Ma'am, because of the neuropathy also, blink rate is low, and in diabetes, inflammatory mediators are more. also tear film instability is there.
Okay.
So will it depend on the duration of diabetes and control of diabetes? Did you take the duration of diabetes as well?
Sir, yes, duration is not significant in my study.
Okay.
Yes, sir.
So
But
any diabetic, even a recently diagnosed diabetic,
Sir, if RBS is more, then it was significant.
and type 1, type 2,
Sir, it was type 2 diabetics only.
so you studied only type 2
Type 2
diabetics.
diabetics.
so like sir said, if it is, even if it's not significant, it needs to be mentioned because that's important. That if it's not proportionate to the duration of diabetes, which we would expect it to be, right?
I haven't mentioned it.
Okay. How is it different from other studies? Because this is
Ma'am,
quite
because
established.
it is one of a kind कि rural में study कोई हुई नहीं है.
How did you maintain the cold chain? Like ma'am said, you've taken the samples from the desert.
Yes, ma'am. We had some box. We took that samples from the place we are conducting camps to the college. Thank you.